So I appreciate the opportunity to be here today to visit a little bit about this, and I would echo the words that Dr. Schwartz said. This has been a collaborative effort, and certainly appreciate the collaboration we've had between different veterinary practices, PIC, and the various universities that have participated in helping to try and solve this particular issue. As it relates to collaboration, the presentation that I'm going to give is largely the same presentation that we presented, Jake, when we had that conference call here back in December. JP, you remember that as well. And so the description I'm going to give clinically is going to match pretty much what Jake shared. We recognized that there was a fertility problem in a number of different gilt breeding stock sources that we were bringing into farms that our veterinary services team were overseeing and providing service to. And so one of what really brought it to the head was the gilts that were coming from a recently stocked 5,000 sow gilt multiplier. It was a line 3 farm that we had begun receiving gilts into commercial farms with, and it was clear there was something different about the gilts that were coming in and how they were performing in the GDU and in the breeding barn. What we saw was reduced overall reproductive performance, and it correlated directly to this particular source. The gilts were normal. We received these gilts at 90% of those farms were receiving those as 21-day-old gilts straight off the sow farm. They were coming into wean-to-finish gilt developer facilities that were right on site of the particular breeding herd customers. And the gilts were healthy. They were PERS negative, MICO negative, et cetera, et cetera. They grew normally. They achieved normal physical maturity. But we had a reduced percentage of gilts demonstrating clear standing estrus at the age that we would have assumed that they should be mature and ready to breed. This was despite aggressive bore stimulation, heat induction, that sort of thing, and what we felt was a strong heat no service platform being exercised in those facilities. The animals would show signs of cycling, just like Jake shared. They would demonstrate, you'd see red swollen vulvas, you'd think, boy, she's going to be standing tomorrow, and then sure enough, she wouldn't. And then pretty soon she was, beyond or past the stage you'd expect her to stand and breed, and it's like what happened. And so it was very frustrating for farm staff, and we experienced a lot of the same issues that Jake mentioned. We did also observe that the gilts were ovulating, and so if we did force mate those animals, a decent percentage of those animals would become pregnant. But obviously that's not what you want to teach your breeding department teams to do, and so this was a complex problem, very difficult to manage through. The other thing that we also observed with this particular source, and we observed it with some other sources as well, was that there was an increased amount of strep suis associated with this gilt source change. And so the farms that were receiving gilts from this particular source that had the standing estrus issue also tended to have an issue with clinical strep suis in the absence of other viral or disease challenges. We saw a lot of meningitis in piglets, etc., and diagnostic work on that strep suis basically showed it to be the same bacteria amongst the various farms. Another interesting observation is that in this particular gilt source we saw a significant amount of conjunctivitis in those gilts, anywhere from 10 to 16 weeks of age primarily. So Jake shared what we saw in the barn. This is essentially the same. Gilts wouldn't lock up, but in order to make breeding target, you had to do what we called an E-breed, or an estrus breed. And I bring that up because I'm going to show you some data here on some few slides regarding farms in this particular flow, and the percentage of animals that the production team basically resorted to doing what we called E-breeding in order just to make breeding target. So some of the data that I'm going to show is really from a 30,000-foot view, looking at comparison of the gilt performance between what we considered an affected sow farm, an affected gilt source and a non-affected gilt source. And these are just some of the definitions that went into compiling this data set. And so this data here shows an affected source, meaning the 5,000 sow farm, line 3 farm that I alluded to earlier, and these are the performance of the gilts from that affected source compared to an unaffected line 3 source producing Cambros that we'd been using for quite some time and had been very, very happy with those results. Now, comparing, I'm not sure how many farms are in each data set. I think there's roughly 20 farms that would be counted in each side of each pie graph here. These would be farms all under common management. They would have the exact same protocols as it related to heat no service and breeding protocols, etc. And so you can see a significant difference as it relates to the percentage of animals that had a documented heat no service event in the unaffected source as compared to the effective source. That's represented in the light blue. You can also see a dramatic difference in those bred with no HNS, and then you can also see the number of animals that either culled or died. And again, this is not just a few farms. You can see we're talking about in the neighborhoods of 50 to 70,000 gilts here. So it's not just sort of a random observation. Affected source number 2 is another farm that was stocked out of affected source number 1. It's also a line 3 multiplier, and so in this particular case we saw the exact same thing. So a farm stocked out of an affected source had the same issue with their gilts that were being sold to customers as well. Here we're looking at the affected source versus the unaffected source in the percentage of animals culled prior to first farrow. And so again, you can see a very significant difference between what we considered a problem sow farm source and one that we would not recognize. And again, the same thing for affected source number 2. So as you can imagine, a problem of this magnitude didn't go unnoticed with our group, and it's really hard to relate the number of hours and really smart minds that went into trying to solve this problem. And this slide really doesn't do that justice. It's just a very brief listing of some things that we looked at, not complete by any means, and certainly JP is going to dig into this pretty deep here in just a few minutes. But we really looked hard at infectious disease. We looked hard at environment. We thought, boy, what are we doing wrong on all these farms? How can we be messing up this many gilts? We started then exploring issues with are there things hormonally that are different? Are we feeding these animals right, et cetera, et cetera. I should probably make a couple of other comments as well. The first comment I would make is that we would have the same observation that Jake relayed as it related to source switches. And so if we went into a farm that was receiving affected gilts and brought them an unaffected gilt source, the problem basically went away to the exact group from the source switch. In fact, most of the farms would use the comment like it was like flipping a light switch. That's a consistent observation, I think, within our team, and I think from others that have experienced the same issue. The other comment I would make is that our observation is that this was not a problem with simply one multiplier or one genetics company. We have documented other sources that would fit the case definition here, if you will, or these criteria, and they would represent multiple farms and multiple genetics companies. And so I want to make sure that that's very clear, that it's certainly not a PIC problem. There are other sources out there that we would define as the same clinical scenario. Finally, before I turn it over to questions, I just want to recognize all of the folks that, at least within Pipestone and the people that we interacted with directly, want to acknowledge all of their efforts. Certainly within the Pipestone team, there's a group of veterinarians, and I can't list them all on our team because I'm afraid I'll miss somebody, but certainly we've worked really, really hard to try and figure out what the answer to this question is. We've also interacted with PIC and a number of others at various universities. Appreciate everyone's efforts in helping solve it, and now I await eagerly JP and Dr. Knox to tell us what they found.